Thanks for joining us today. We're happy to have Ellie Saul here to talk about what you need to know and enroll for Medicare benefits. She has been teaching Medicare classes and helping financial advisors with health protection analysis for their clients. She believes teaching Medicare is her calling and that there is no one-size-fits-all solution. She is passionate about providing educational resources for her students without promoting a specific company or product. Knowledgeable and enthusiastic, she teaches with simple illustrations and relevant stories to make learning the ABCDs of Medicare fun. So thank you, Ellie, and welcome.
Welcome to the ABCDs of Medicare. My name is Ellie. Thank you so much, Jennifer and Fort Worth Public Library, for having me today. And thank you all for being here. Learning about Medicare can be super frustrating. I've been in this field going on 10 years, so I have a little bit of an understanding of how difficult it is to come along true educational resources. In fact, even if someone goes online and does a search for Medicare options or Medicare education in your zip code or your area, typically whatever pops up first is whatever company paid the most to be #1 that day. So there is a lot of advertising, there is a lot of noise, and there's a lot of misinformation. And part of that is because there are basically two sides of Medicare coverage. And one side is not-for-profit. And that side doesn't have a whole lot in the budget for education. And the other side is 100% for-profit, and they spend millions of dollars every year advertising their little hearts out. So because of that, you'll probably get a lot of invitations that may be a little bit flashier than coming to the library on a Saturday morning to learn about the ABCDs. You'll probably get invited to suppers or free steak dinner and different things like that. And a lot of invitations that you'll receive will likely be sponsored by insurance companies. Today is not sponsored by an insurance company. I don't promote one company or another. I do earn a living helping people with health, life, and retirement planning. The type of license that I hold permits me to be compensated by any of the insurance companies in the state. I also have a professional designation that requires 40 hours of super fun continuing education every year. So I try to stay up to date on all things Medicare related. Another reason not a lot of people hop in and want to teach this class in a library educational setting is because they're pretty strict on what we can and can't say. And we're actually encouraged often by multiple insurance companies not to do educational meetings because, and I quote, they're not profitable. So to me, that's kind of a shame. A lot of times when I get to meet with people, one of the things that I hear is, why is it so complicated? Why isn't there just a simple way to do this? I've even heard people say, why can't there be a guide? Well, it may surprise you, but there is a guide. It's literally called A Guide to Health Insurance for People with Medicare. And it's published by the Centers of Medicare and Medicaid every single year. There is a guide. In fact, if you got a handout, then on that handout, you may notice a tiny little 7 on the top of the page. That page represents the page that you're looking at from that very guide. If you text message or send me your email address, or if the library has access to it, I'll be happy to send you a digital copy of the entire guide. Again, since we're only staying 3 or 4 hours today, kidding, it'll be 1 hour max. Okay, I've said the joke like 4 times in here, so keeps getting a little bit less funny every time. But if you would like one of those, I will be happy to send you a digital copy. Okay, having said that, one of the rules that I abide by to get to teach this class is I'm not selling you anything. I can't. It's one of the rules. So if you came here today hoping to buy something, I hate to disappoint you, that's not going to happen. Okay, we're going to go over the ABCDs of Medicare. Now, if you would like an individual consultation, I always do those at your request, also free with no pressure, and try to help you make a good decision for where you are. Even though that is how I earn a living, I don't call you, I don't bug you, I'm not going to try to harass you or even ask for your number. If you would like help from me, I would love to help you, and you're more than welcome to reach out. I will say yes and put you where it's convenient for both of us on my schedule. That fills up pretty fast. All right, do you feel better about the class already? Medicare is awesome, and not a lot of people think of it that way. But when you become eligible for Medicare, most of the time, you become eligible for better coverage than you've ever had. In fact, most of my clients pay a lower premium for Medicare coverage than they've ever had to pay for health insurance. That's great news. Not only can you get better coverage, usually for a lower premium, you have guaranteed insurability. What does that mean? That means you have a window when no one can turn you down for any coverage that you choose. This has been a very powerful window to many people who I'm so thankful that I've gotten to help, like someone who was already going through cancer treatments with chemotherapy and radiation. In the middle of that treatment, because of their window of guaranteed insurability, they were able to get coverage that paid for every dime without being turned down or even asked about their current health situation. So it can definitely be life-changing and wonderful. And after today, I hope that you will feel confident about that change coming. I'm a very visual person. I learn with pictures and I teach with pictures. So today we're gonna take notes and draw pictures. Are you ready? Okay, at the top of your paper, it says start. Where it says start, I want you to write down the date that you get to start Medicare. Everyone becomes eligible for Medicare on the first day of the month that you turn 65, unless your birthday's on the 1st. Anybody born on the 1st? Maybe somebody online. If anyone is born on the 1st, they get to go back one whole month just for being born. Isn't that awesome? And for the rest of us not born on the 1st, like me, for example, my birthday is in December. It's the 12th if you want to send me a card. Just kidding. So for me, I'm going to put 12/1 because that's the first day of the month of my birthday. For you, go ahead and write down the first day of the month that you turn 65. Because that's when you will get to start your benefit. Now, sometimes people become eligible for Medicare prior to that date because of a permanent disability that has lasted 24 consecutive months or more, or a specific diagnosis like Lou Gehrig's disease, ALS, kidney failure, things like that, okay? But even if you've had Medicare for years prior to your 65th birthday, I still want you to write that date down because for you, that is going to be a marker of guaranteed insurability. Did you know that in my field, people refer to your birthday, turning 65, as a golden ticket? What does that mean? That means you have this one window. Like Willy Wonka, you get one golden ticket that permits you to buy any coverage that you want without being turned down, which is pretty awesome, even if you've been eligible for Medicare prior to that date. So does everybody feel good about your start date? We got to know where to start. Everybody good on where to start? All right, let's talk about how. How do we start? Well, if you're already retired and drawing a Social Security benefit, that includes a survivor benefit or a spouse benefit or Social Security disability benefit or SSI or railroad retirement. If any of those apply to you, you're already done. All you have to do to sign up for Medicare is wake up and go to the mailbox. They'll send you your card in the mail. You'll have it about 3 months before your start date. When that card comes in the mail, it'll come in an envelope that's white, that's about the size of a piece of paper folded over in half. It'll say that it's from the Centers of Health and Human Services on the top, and right below that, Centers of Medicare and Medicaid. On the back, it says important, much like a lot of your junk mail I'm sure you're receiving. So if you accidentally throw it away, that's okay, because they've actually got it set up now to where you can print a temporary online or order a replacement, okay? So if you're already drawing any of those benefits, you're already done. They have your number, they know where you live, they will send you a card. Isn't that exciting? So all these crazy people calling you and sending you letters saying, you only have so much time, trying to put the pressure on you, there's no pressure, okay, you're done. If you're not drawing a benefit, if you're not retired, you don't have to be. You do not have to retire or draw Social Security to be eligible for Medicare. It's your right to begin this benefit on the first day of the month that you turn 65, whether you want to retire or not. However, if you're not drawing one of those benefits yet, you do have to sign up. Right now, there's only 2 ways. Okay, you can do it on the computer at ssa.gov. Every time I say that, I get a little nervous on the inside because I've seen many people accidentally put it in the search bar instead of the address bar and end up in a black hole of advertising and giving their information out to people who are not the government and getting lots and lots of phone calls. So if you want to go there, make sure and go to SSA, that stands for Social Security Administration.gov, G-O-V, okay, in the address bar. You can scroll down to where it says apply for Medicare benefits online. If you already have a My Social Security account, listen to how cool this is. When you open your account and log into it, as soon as you're eligible to apply, it'll populate the buttons necessary. And it's like 2 clicks. It's a very simple process. So if you are not very close to this date, but you want to get a head start, you can make a My Social Security account online. Pretty fun, huh? You can sign up online up to 3 months before your birthday, okay? So for me, for a 12/1 date, I could sign up today if I wanted to, right? You could start September 1st if you have a December 1st start date. You also technically, legally, without penalty, have 3 months before, the month of, and up to 3 months after to apply without getting any kind of penalty. Any penalty that you get in life with Medicare is permanent, so you just want to try to avoid those at all costs. And if you want to start when you're first eligible, which is when it will be the least expensive for you in your lifetime, then you want to get it done beforehand. Okay, so when you apply is going to determine your start date. If I, for example, apply anytime between September 1 and the end of November, I get to start on this day. If I wait and apply the month of my birthday, I have to wait till 1 month after my birthday. If I apply 1 month after, it's 2. If I apply 2 months after, it's 3, unless there's some other circumstance that allows me to make that number different. So if you want to start when you're first eligible, just get it done. Rip the Band-Aid. There are computers in the library. If you would like assistance with this, I'll be happy to help you. You can probably even do it on your cell phone if you have a smartphone. It sounds more complicated than it is. It actually is very simple, okay? And if you don't have a My Social Security account yet, those are pretty fun. They're pretty neat. There's been some amazing updates and just clarity for you to be able to look at your benefits, see what's eligible and what date may make the most sense for you to even begin that benefit, okay? So we can do it on the computer, or you can call your local Social Security office and make an appointment. right now, at the time of this recording, September 25th, 2021, they are not accepting in-person appointments for Medicare yet. Okay, so that means that these appointments will be phone appointments. Depending on your zip code is going to determine the number for your local office. If you want help with that, you can text message me your zip code, or we may be able to put a link in the bottom of how to find out your specific office's number. Because if you don't do that, you'll call the national Social Security number and wait for a day and a half, possibly like 20-30 minutes, and then they'll tell you to call your local office. So just start with the local office, ask them for an appointment to sign up for Medicare. The last person I helped to get this type of appointment, the appointment was already 45 days out. So if you're a last minute person, don't wait till the last minute if you want to do it over the phone. They won't let you apply as soon as you call over the phone. You have to make an appointment because sometimes the person who's answering the phone is not a Medicare knowledgeable person. So that's to your benefit too, that you get to make an appointment with someone who can help you with that process. Again, technically, legally, you've got 3 months before, a month of, and up to 3 after to do so. But if you want to get it done before your start date, when you're first eligible, just get it done. Okay. Any questions on how to sign up? What if you missed your window? Yeah, so that's a really good question. It kind of depends. So I forgot this disclaimer. Sometimes I can't just answer something that may not apply to everyone. Some beneficiaries who miss their window are eligible to apply because of other coverage that they've maintained. Some beneficiaries who miss their window end up having a penalty. If you have a penalty for not applying on time and you don't have any other credible coverage that's considered credible by the Centers of Medicare and Medicaid, you will only be allowed to sign up the following general enrollment period, which is January 1 through March 31. And your start date, your effective date, will not be until the following July 1. There's also a 10% per year penalty that gets put on your premiums, and that's a penalty that's forever. Okay. Good question. Everybody okay on when you sign up and how you sign up? It's not that bad. Yes.
Question. If you did miss your window, can you still get the Advantage plans or any other plans or just
You
Medicare?
possibly could once you actually get to sign up for Medicare.
Oh.
So it just depends on when your start date gets to be, and based on that, you can choose coverage to go with it. Okay, good question. Everybody good? When and how? You're doing amazing. I told you this would be fun. All right, has anybody ever eaten at Kentucky Fried Chicken? All right. This is not a commercial for them. I'm not sponsored by them, but have you at least heard of it? KFC. Okay, you know the guy that started it, Colonel Sanders? Do you know how old he was when he fried his first piece of commercial chicken? 67. In fact, at 65, so I want you to think about this classroom and imagine one of your peers, a 65-year-old boy who is sitting by himself over there because he's really down for the moment. At 65, he just declared bankruptcy, got a divorce, and sources on Facebook and Wikipedia, so I know they're true, say that he was severely depressed and suicidal. So depressed and desperate for cash that he got a part-time job at a service station. In the back of that station, he's messing around and comes up with an original recipe, starts frying chicken in a gas station and selling it. And the rest, as they say, is history. Did you know that if you were born between 1954 and 1958, statistically, scientifically, mathematically, based on actuarial tables, that's claims for health purposes, and morbidity tables, that's death times, you're going to live longer than anyone ever has. So what do you want to be when you grow up? I'm serious. The first time I asked that question, there was one woman in the front row. She didn't hesitate, man. I said, what do you want to be when you grow up? And she raised her hand and said, healthy. I thought, okay, we got a winner, winner, winner. KFC chicken dinner, get it? Okay, because that's one thing we have in common, right? We all have more than what Colonel Sanders did when he was turning 65. Right now, we have more than what he had. And statistically, we're going to live longer and better than he ever dreamt of. So when I say, what do you want to be when you grow up? I really want you to dream big and think about it. Okay. And we'll just cover how to be healthy because we all have that option. Science has advanced, y'all, and medicine has advanced where we can outlive things that we used to not be able to, right? We just have to be able to afford it. And when it comes to Medicare eligibility, we can do just that. So let's talk about how that works. Y'all ready? On your paper, below the word start, there's another little word, OR. Okay. That word's a little small for my liking. So take your pen and draw a line right down the middle of your page. Here's another disclaimer. The page that you're looking at is actually from the 2017 book. And the reason I use it is because it is simpler than the one that they made this year. But in 2021, guess what? There's a line in the middle of the page. I'm not saying they heard my class, but you know, who knows? Who knows? You got to draw a line. Why do I want you to draw a line? I want you to draw a line because I want you to remember you do have to make a decision. Okay. And it is either or. You can either choose original Medicare or Medicare Advantage. You can't have both. And we're going to talk about what that means and the differences. So in honor of Colonel Sanders, let's start with the original recipe. Get it? I thought you might. Okay, so original Medicare. You'll see on your paper there, it has two main parts, Part A and Part B. Part A and Part B work together to give you a little over 50% of your total health cost. Between 65 and heaven, we spend a little over $16,000 per year in medical cost. So to know that with original Medicare, you've got half of that taken care of off the top can be a lot of peace of mind. Okay. Now let's talk about how Part A and Part B work together. Medicare is a type of insurance. Nobody likes that word, but we all have it, right? Like, does anybody in this room have car insurance? If you don't, I'll report you. I'm just kidding. Online, you're getting a freebie here, but if you have car insurance, you already kind of understand a little bit about Medicare. At least you understand that with any insurance, you've got premiums. Premium is how much you have to actually pay to buy the coverage. And you likely have deductibles. Deductible is the amount that you have to pay before your insurance pays when you use it. Okay, so that's going to help us as we talk about Medicare. Medicare Part A has a deductible, but before you panic, not everyone has to pay this deductible because some beneficiaries opt to purchase a supplement or Medigap policy, in which case your Medigap or your supplement could pay the deductible for you. That's a fun ride too. That's a ride you've never had. Actually, I can't get anybody to pay my deductible. And it's high, except maybe my husband if I'm real sweet, I'm kidding. Okay, Medicare Part A also has a premium. Don't panic on the premium. The actual premium for Part A is over $400. However, most of us don't have to pay that anymore when we start our benefit. So has anyone in this room worked at least 10 years in America and paid your taxes? Okay, if you or your spouse, who is at least 62 years old, has worked for 10 years in America and paid your taxes, you've got 40 quarters, which means your premium for Part A when you begin your benefit is $0. So you can write that in the box. That does not mean it's free, even though your peers will likely say, oh, get Part A, that's the free one. It's not free. Okay, it's $0 to you because you already paid it. I have clients who pay nearly $500 a month for this benefit. Okay, in fact, I have one client who pays more than that. We'll talk about those options later. But if someone immigrated to America later on in life and did not have enough quarters, or if they were advised not to pay into Medicare, then they could have to pay that. Okay, but you've already paid it. So every time you saw taxes coming out for FICA or Medicare, this is what you were buying. You were pre-purchasing a portion of your retirement health insurance, and now you get to reap that reward. Isn't that wonderful? So just relax and enjoy that $0 premium, but don't let anybody tell you it's free. Fun note, on average, that means that that's about 20,000 hours of work. I would say that that is not free. Have you ever had to work? All right, so Part A. Part A is called hospital insurance, but it does more than that. Part A is going to help with hospital, hospice, that's end of life, skilled nursing, not long-term care. Okay, long-term care means you've moved in. Skilled nursing means there's a day you're leaving, you're there by doctor's orders, and you're showing improvements. Okay, long-term care is not covered by Medicare. That's another class for another day. Okay. Part A also helps with home health. So that's a lot more than just hospital. Part A does, remember, have a deductible. It's a little bit of a different deductible than we're used to. Part A has a 60-day benefit period deductible that either you or your supplement or Medigap down at the bottom could have to pay multiple times a year. That's right, someone else can pay your deductible, and that's right, you may have to pay it more than once. So the 60-day benefit period deductible is currently $1,484 that either you or your Medigap, also called Medicare supplement, could have to pay multiple times a year. The way that a 60-day benefit period deductible works is, let's say someone goes into the hospital, okay, either them or their supplement pays it. They get treated, they get better, they get released. Anytime that same patient is out for 60 consecutive days and then goes back into the hospital, either them or their supplement Medigap plan has to pay it again, okay? So you could have to pay it more than once, or your Medigap could have to pay it more than once. Once that deductible is met, Part A is brilliant, and they do more than what most major medical coverage that I get to look at for clients every day does. After this deductible is met, Medicare Part A begins to pay 100%. That's awesome. They pay 100% in a skilled nursing facility until day 21. Day 21, you or your supplement pays $185.50 per day. They pay 100% in the hospital after that deductible's met till day 60. Day 61, you or your supplement pays $371. Day 90, that doubles to $742. Okay, and all of that can be picked up by a supplement or Medigap if you want to. So that's Part A: hospital, hospice, skilled nursing, and home health. Then we have Part B. Part B is amazing. Go ahead and write down $148.50 for your Part B premiums. Usually I tell people to put a little star beside it because $148.50 is the standard. I'm so excited, I'm just dropping my pen. Sorry, camera. Okay, $148.50 is the standard Part B premium. That means that there may be some people who pay a different amount, okay? If your modified adjusted gross income 2 years prior to your Medicare start date was over $88,000, as a single person, the married number is a little bit higher, you could receive a letter notifying you that you may have to pay IRMA, income-related monthly adjustment amounts. This is also something that we talk about one-on-one because everybody has different income and different things going on here. They will only look at your income 2 years back because that's all that they have access to. So if your income has changed, or if it looks like it's gonna change, or if you got married or divorced, or a spouse passed or retired or worked less, there are different reasons that you could actually appeal that and not have to pay it. Okay, so if that's something you have a question about, there's a specific form that you can fill out, and I can help you fill it out, or at least find the form if you need to. Okay. On the other side of the coin, there is also extra help for lower income. It is possible to qualify for Medicaid, that's financial aid for low income, and Medicare, that's health care for seniors at the same time. It's not automatic, even if someone has been on Medicaid for years and years, and there is also a limit on the assets that you can own as a family and as a single person. And if you have questions about that, again, I'd love to help you. I do know that they're pretty strict, but in the state of Texas, for the most part, we can make more and still get extra help than anywhere else. And that feels pretty good too. Yes.
I have a question online that kind of fits in right here. Is a 2-year look back only done at sign up, or is there checks throughout your lifetime?
That is such a good question. So originally it's done at sign up. And what I have found is if it's supposed to go down, they don't automatically change it. And if it's supposed to go up, they do. I don't know if it's on purpose or if there's just a different trigger in the system. But if your income changes, no matter when it does, or if one of those life events applies to you, you can fill out the form and get the exemption moving forward. Okay. And I always say, do it. You're not getting anything extra. And the only way someone could be charged more is if they made more, which also means they paid more for it already. Right? So super fun. Blah, 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 blah. Most of us, it's going to be $148.50 a month. Right? That's the standard average premium. Most of us, this premium will actually get deducted automatically out of your Social Security or survivor benefit or railroad retirement benefit. You won't even see it. You don't have a choice. They're just going to hold it. Okay. Just like working years, sometimes, you know, we have someone dot all our I's and cross all our T's for them to just hold back a portion of our paycheck for our insurance. Social Security helps in the same way. If you're not drawing, remember, you don't have to draw. You do not have to retire to get Medicare. It's your right to get it when you're first eligible. In that case, though, they will send you a bill. Medicare sends a quarterly bill to begin with, which means you'll have 3 months worth of premium on there at the same time. It's not a quarterly premium. Technically, it's a monthly premium. So if you had rather pay it monthly, you can do that. Okay. It is a monthly premium, and I have clients who need to pay it monthly because that's what makes the most sense for their budget, and it's a monthly benefit. So if that is the case, if that applies to you, let me know because there's a form for that. But it is possible. Okay. Or you can pay it quarterly and just let it ride. Now, what in the world is that $148.50 a month going to get you? A whole heck of a lot more than nearly $1,000 a month. Gets someone like me, not on Medicare. Part B is going to help with doctor's visits, specialist visits, any kind of outpatient physical therapy, occupational therapy, speech therapy, if anybody has a stroke or anything like that. Durable medical equipment, walkers, rollators, CPAP machine, diabetic testing supplies. Y'all, Part B will even pay for the majority of your insulin if someone is insulin dependent and they use a pump. If you self-administer, that's Part D, and we're going to get there. But if someone uses a pump, Part B will pay for the majority of that. And I'll tell you right now, the pharmacy is not advertising that, and they may not be super excited about it when you tell them. And if you need me to hold your hand, I will, and be very stern because it's your right. And that can change someone's entire financial outlook if they have had to pay out of pocket for that insulin. So self-administering again is Part D, but if you use a pump, that comes from Part B. Part B also helps with ambulatory services and emergency room visits. Before we become eligible for Medicare, some of you may have experienced this. A lot of times you'll find that the hospital and the emergency room that's by it are not in the same network. So sometimes you hear these stories of someone going to the ER over here and then going over there to the hospital, and it's just like such a mess to try to figure out who's paying for what. But when we become eligible for Medicare under original Medicare, you don't have to worry about that because you've got Part A and Part B working together to make you whole. Part B is going to be in the emergency room if you get treated and better and released. If you spend the night, if you get checked in, you're rolling over into Part A territory and Part A rules. Okay, so that's pretty exciting. Differences coming up there too. Then Part B also helps with lots of surgeries and procedures nowadays are outpatient. I always say if you've got Uber or Ride, they'll send you home. And that's great because we can heal better statistically at home, and it's certainly more economical. But that means those could be some really big dollars covered by Part B. Part B also helps with cancer patients, chemotherapy, radiation, treatments like that, transfusions, dialysis. That's a lot of coverage, right? Part B does have a deductible. Y'all remember what deductible is? It's what you pay before they pay when you have to use it. Guess what? It's only $203 right now for the whole year. Once you meet that $203, I know, right? I don't want to tell you what mine is. I don't want to make you sad. Okay, and it's not about me, it's about you. Okay, so $203. Once you meet that deductible, Medicare, original Medicare, will pay 80% of everything I just listed and in some. You or your Medigap, Medicare supplement, can pay the remaining 20. How cool is that? You could not even have any out of pocket at all. Now, most doctors, most hospitals will take Medicare. Why? Over 80% of income earned in the medical field in America comes from services rendered to someone 65 or older. Why does that make me smile? Why is that good for you? You have power you don't even know you have. That means if someone doesn't take you, if they don't accept original Medicare, statistically, mathematically, they're not going to make enough money to stay open, right? Do you know anybody who wants their child to become a doctor just to do good deeds? No, you want them to make a living, right? We have to earn a living. So if they want to earn a living, they have to take you. That's wonderful. That also means that they will be statistically better at doing exactly what you are most likely to need because it's what they do most often. Good news all the way around. However, just because you will likely be accepted nearly anywhere under original Medicare, doctors can choose to not accept Medicare assignment. That does not have to scare you because all that means is they can charge a little more. The cap is 15%, which means they can charge 15% over and above what Medicare approves. And guess what? Either you or a Medigap or Medicare supplement will pay that 15%. Okay? So far, we have A for hospital. We have B for doctors. Then we get to D. Can anybody guess what D stands for? I'll give you a hint, drugs. Okay, D stands for drugs. I say D stands for date. You want to date your drug plan, don't marry them. What do I mean by that? Every year you get to change your prescription drug coverage. And that's not even necessarily the best part. The best part is when you become eligible for Medicare, you get to pick your own drug plan based on what you're actually taking where you go to the pharmacy and your zip code. So where you live, where you want to go, and the actual medications that you're taking will tell you the best possible coverage for you. And you have a choice. Imagine working years going up to Susie and HR and being like, hey, can I get some money back because I only have one statin? No, it's not going to happen, right? But when you become eligible for Medicare, you don't have to just buy a plan because of how awesome it is that somebody's trying to sell you. If they don't know anything about your medication and they're trying to sell you a plan, there's probably something in it for them, okay? Not for you. And I say that because there's 30 drug plans in the state of Texas. Isn't that wonderful? We got options. They range in premium. That's what you pay every month, anywhere between about $7 a month all the way up to over $140, depending on the plan that you choose and the company that you go with. Now, if you have a passionate brand loyalty to a specific logo attached to an insurance company, just let that logo love go somewhere once you're eligible for Medicare, because the brands are no longer the same, okay? And in fact, a lot of times different companies will buy a logo as intellectual property because they know that someone's likely to choose a brand that they're familiar with, when that has nothing to do with how these Part D plans work. These plans all work the same way, okay? So they've got the same basic build, but they have different formularies. So they put different medicines on different tiers. They have different co-pays they assign to different drugs. They're accepted at different pharmacies, preferred at others, not taken at the rest. So you can actually come up with a brilliant customized solution that fits you the best. And you don't have to keep it forever. You can date them and change them every year. Now, personally, early on in my career, I just made a decision to not be compensated by any Part D plans. Why would I do that? Have you ever had one boss who knows it all? Imagine 30 bosses who know it all, and they want you to tell people they're the best there is. And you know in your heart it's not true. It's a simple puzzle that you can put together for every person. So the way that I help my clients with this, the month before you start, I do a Medicare Eve appointment. And at that appointment, we make sure that you've got your ducks in a row, including that you have the Part D that's going to work the best for you at that time. So what I do is I plug in your medication, your zip code, the pharmacy that you prefer on the government database. I've got it on my cell phone. And based on that, they tell us the least expensive option for you. It's awesome. You can budget per month, per drug, per year, however you want to. You can look at different pharmacies to see if there's a better option for you. And you have access to that database. You can get there by going to Medicare.gov. When you go to Medicare.gov, you can also end up in a black hole of advertising where you may accidentally give someone your information and they will not leave you alone. Okay, so when I say it, I get a little scared, but you can get there by going to Medicare.gov. Okay, if you need assistance with that, let me know. It is a free service that I provide. It's also a free service that the Area Agency on Aging will provide, and those are located all over the Fort Worth metro area. And if you're watching this online and you're not in this area, you can Google it too, just Area Agency on Aging. Make sure those first little things that pop up, if it says add beside it, it's probably not what you're looking for. Okay, Medicare is not going to advertise that I know of. Okay, so every year between October 15th and December 7th, you can make a change to your prescription drug plan for the following January 1, which is why I say date your drug plan. Don't marry them. Because when you start dating them, you can pretty much know exactly how it's going to work for that calendar year. But the following January 1, there could be a completely different picture for you if you don't at least check it out. So we've got A for hospital, B for doctors. You date your drug plan, brand new, right? Super good. And now I want you to take your pen and draw a heart That's right, a heart around the box on the bottom that says Medigap or Medicare Supplement. The reason I want you to draw a heart, I've already confessed, I'm very visual, but when you leave here, I want you to remember this. You have another right here that you've never had. When you become eligible for Medicare, you can choose coverage that's guaranteed renewable. So to remember what that means, I say you can marry your supplement or Medigap. Those are the same thing. What does guaranteed renewable mean? It means not only do you get to pick what's covered, you get to keep it from this day right here until heaven. They can never drop you and they can never change your coverage. You've never had that right. Susie and HR, give me the plan from 07 where you paid and I didn't. It doesn't work that way, right? Every year, even in the marketplace, when we're looking for individual insurance, somebody else tells us our choices. Somebody else tells us what we can and can't do. And it changes every year. But when you become eligible for Medicare, you have this right. You get to pick what's covered. And if it's guaranteed renewable, working with original Medicare, they can never drop you. They can never change your coverage. And that is peace of mind for sure. You can buy one for anywhere between about $40 a month all the way up to $200, depending on the coverage that you select and the company that you go with. These Medigap plans, the Medicare supplements over here, are going to pay as much of the out-of-pocket as you want it to, right? That's up to you. Now, these plans are standardized on page 11 of the guide that we'll send you a PDF of, or at least have some kind of access to with the online portion. On page 11, it shows you the standards set forth by the government for these different plans. Because they are standardized, you will have some salespeople call you and probably send you advertisements in the mail. That'll be a letter with a list of brand names, and beside the brand name, the price of a specific plan. And they'll say something like, they're all the same, get the cheapest one. If they were all the same and you should get the cheapest one, I assure you, the Centers of Medicare and Medicaid would not waste a dime putting together a guide to pick one every year, which is what I'm teaching out of, a guide for health insurance for people with Medicare. They're not going to put money into something if it's as useless or as easy as get the cheapest one. In fact, that same guide says that the cheapest one to begin with can and will most likely be the most expensive to own in a lifetime. Some of these premiums that insurance companies set up, and they have to file this with the State Department of Insurance, are introductory premiums. What does that mean? They can come up with any number they want to. It can be $29.99 for the first 6 months, right? Have you ever gotten cable with their introductory offer? And who gets cable anymore? And I've seen that sometimes just happen because guess who all knows that you have a golden ticket of guaranteed insurability? Guess who knows when that guaranteed insurability ends? Every single insurance company in the country, right? So a lot of times there are plans that will be brand new to the area, and you may or may not realize it because of a logo that they purchased or use, but you'll know. You can kind of look at the pricing and see. So page 27 also tells you some other things to look for. It says, go to the library. You're doing it. Why does it say that? Remember, I told you there are things we can and can't say, and this has to be educational, right? I can't say, hey, you should really try this company or that company and buy you a steak. No, it's educational. So you're already doing the first step. You should feel really good about that. You're ahead of your peers. Number 2, it says you can check with the State Department of Insurance. It's public information. If a company has, what's it called? Oh my gosh, complaints filed against them. If a company has complaints filed against them with the State Department of Insurance, you have access to those complaints. You can see them. That's awesome. That can definitely help you. On page 27, it also says you want to look at the financial stability. The first company it mentions to look at is a company called Weiss. WEISS. There are lots of rating systems. Most of them are paid by insurance companies. WEISS, WEISS, is not. They don't take any compensation from insurance companies. In fact, they go in and do an audit of insurance companies to see how well they're paying claims real time. And then they release that along with their financial means and how likely they are to operate in different economic climates to the public. That's awesome. So every month I run a safety report. WEISS will only put a company on that safe report if they're B+ rated or higher. Why does that matter? If you think back to the picture of marrying a supplement, if I tell a friend to marry a fella, he needs to what? Pay and stay at the very least. Pay his bills, don't mooch, and stay, right? Don't just leave you at the end of the year. That's what you need to know about your insurance. If you have the right to marry them and keep them forever, you want to know that they're paying claims. And you want to know they have the means to keep paying your claims when you're 102, because you're going to live longer than anyone ever has. That's what that rating tells you. So in the great state of Texas, we've got over 100 options here any given year. And most of the time it's public information, how long they've been around, right? Or how long that specific carrier's been there, or if they sell blocks of business to other companies. But this WEISS rating can really help you, because if you take over 100 and you funnel it through B+ or higher, you're down to less than a dozen. Okay, that's good news. That means that can really help you know a direction to go in. Okay, you can also get the help of someone like myself or someone at an area agency aging, or a local agent that you know, who can help you make a decision here and lead you in a good direction for you. Okay, so far, this has been all phenomenal news. Under Original Medicare, you can have A for hospital, B for doctors, you date your drug plan, you can marry your supplement, or you can,
Before you move on,
wait a minute.
hold on. I gotta scroll up and find it. Okay, please talk about how Tricare for Life and how it works with Medicare.
Okay, great question. So Tricare for Life, thank you for your service if you're asking that question. Tricare for Life is a program that veterans who have retired with 20 or more years, or spouses, or widows, or widowers, have access to. Tricare for Life works like a Medigap. The only requirement other than your service, which if that applies to you, thank you for your service, and we mean it sincerely from the bottom of our grateful hearts. But with Tricare for Life, all you have to have is Part B over here, and a military ID that's current. Most military IDs, if you look at it right now, it's going to expire right about the day before that. It's pretty clever, huh? Because they know. You better get your butt up there so you can learn a little bit more about Tricare for Life. You need to have a current military ID and your Part A and Part B, and that's it. You're not going to have to pay a premium for Tricare for Life. What you need to know very specifically, if you have it, you can go pretty much anywhere and do whatever you want to, and they'll pay for it because you've earned it. And that's the way that it should be. However, they coordinate benefits. What does that mean? That means if you pick another plan, like let's say somebody sells you a plan because it's $0 and you think, what could that hurt? Well, if you have any other coverage, Tricare for Life is not going to pay. So that's how that could hurt. So if you have Tricare for Life, don't let anybody sell you anything, especially something that would cause your Tricare for Life benefit not to pay. Now, the only thing that they don't cover is like dental, and Medicare doesn't pay that either, but there are plenty of standalone dental coverage options in America. Good question, Tricare for Life. So that's going to be your you're going to marry Tricare for Life. Okay. And that is different from just standard VA benefits. All right, so we've got original recipe, A for hospital, B for doctors, date your drug plan. You don't even need a drug plan with Tricare for Life because that's considered credible. They'll even pay for your prescription coverage. However, if you ever have the need to pick one up, you can without penalty because you deserve it. Thank you for your service. And marry your supplement, or let's talk about extra crispy. Get it? I brought it back. Okay, Part C or Medicare Advantage is not a part of original Medicare, even though it's called Medicare Advantage and Part C. Medicare Advantage is private health insurance contracted with the government to manage your care instead of original Medicare, not in addition to. You can buy one in the state of Texas for $0, all the way up to over $400, depending on where you live and what's available to you. If you buy a Medicare Advantage plan, you have to surrender your right to original Medicare while you have it. What does that mean? Original Medicare is not going to pay any of your claims. So if you go to a facility that's not approved by your managed care plan, you will be showing up as private pay. I get these calls all the time. How come Medicare ain't paying for this? Well, you don't have Medicare. Now, the salespeople will position this as, you don't need your red, white, and blue card. Just use your insurance card. And what they mean is, Medicare is not going to pay any of your claims. Okay, so just know that it's an alternative. So you get it instead of, not in addition to. Again, in the state of Texas, we're blessed. We have lots of options, but these are not just state specific, they're county specific. So in our great state, most of the time they combine hospital, medical, and prescription drug coverage in one HMO or PPO, which means that there are network differences. If you have a Medicare Advantage plan, even though you surrender your right to original Medicare, which means you may get a bill that shows your insurance paid this, but then over here with like anesthesia or something else, it says private pay. That's because Medicare, original Medicare, is not going to pay any of your claims, but you have to keep paying this premium. Okay. And you're not getting any money back from Part A, what you paid into it, even though they don't have to pay any of your claims. But this money that you keep paying in is going to come over here to help subsidize the premium for your managed care coverage. Now, they do advertise that you get A, B, and B all in one for $0. And what they mean is you surrender your right to Medicare paying any of your claims. You also get drug coverage included, but that means you give up your right to choose your own prescription drug coverage, right? Because over here, you pick your own plan based on what you want and where you go to the pharmacy. Over here, it's bundled into one managed network plan. So then you've got some of those situations where you may have to change pharmacy or medication or whatever, or pay whatever is included in that plan. But they do combine hospital, medical, and prescription drug coverage in one HMO or PPO. They also have a minimum standard. The minimum standard for Part C is to cover what A and B without any supplemental would. So remember, it was like a little over 50% for A and B combined. However, they have the freedom to do so within the limited means of their own restricted managed care plan, which means they can require prior approval from the plan before someone gets a procedure done. So let me show you what that looks like in a picture. Original Medicare, it's black and white, it's public information. All right, if you really want to know what you can have and how much it is, you can get that information. It's the same for Bobby as it is for Sue. Bobby needs XYZ surgery, Sue needs XYZ surgery. They go wherever they go, they get it covered. Medicare pays the same amount for both of them. Their supplement or Medigap pays what's left and the patient is whole, okay? With Medicare Advantage, they have to say, we will cover XYZ surgery if you get a prior approval. And then you have to go through whatever process they say, or if you go to this doctor over here, or if you do this or that. So it's not as black and white as this is exactly what it covers. It's public information. You get what you get. You don't throw a fit. And a supplement can easily come in and pay the rest because they know what their out-of-pocket could be. With a Medicare Advantage plan, you surrender your right to being able to buy a supplement. Okay, so a supplement or a Medigap can't work with something that's not black and white where the lines are clearly defined. That would be like getting insurance to cover your insurance because your insurance doesn't cover something. Does that make sense? Okay, so on Part C or Medicare Advantage, you can't buy a Medigap. Okay, you can't buy that. So what does that mean? The out-of-pocket exposure over here that you can get a supplement or Medigap to pay, you can't over here. So you'll have some out-of-pocket, okay? So in Texas, anywhere from $0, this will be really big on all the ads, to $0 primary care. Anywhere from $0 all the way to $45 for a doctor's visit, $18 to $65 for a specialist, $195 to $595 per night in the hospital, $250 to $850 for an ambulance ride, 20% of durable medical equipment. I'll give you an example of how the medical equipment works. I have a dear client, and I won't give you any like personal information, so I'm just sharing this story. Her husband is younger than she is, and he has MS, and his MS has progressed significantly, so he had to get a wheelchair. He has a Medicare Advantage plan, and they would not approve the wheelchair that his doctor thought would make the most sense. So they went back and said, okay, well, what can we have? And they went with a vendor that their plan approved and the actual chair that their plan approved. And after going back and changing, right, to conform to what the plan said they could have, they still had to pay 20% out of pocket. And for them, that was $2,500. So for some families, that's no big deal. I mean, $2,500 for a wheelchair, but in this family, it was really hard. Okay, so that's what I mean by you have to go in their network, you have to get what they approve and pay 20% out of pocket. Also, cancer patients. So if someone with a plan that's an Advantage plan has a cancer diagnosis, they have to go through the managed care that's approved by their plan and pay 20% out of pocket for their treatments, or go wherever they want to in private pay. It's America, knock yourself out. So the maximums over here, the out-of-pocket exposure for this year, we don't know 22 yet at the time of this recording. We'll probably know by October 1st. So if you want to call me next week, is over $11,000. This number changes every year. So far, every year that I've done it, it has gone up. So, and that's just, you know, what you can't get a supplement to pick up on this side. Now, there are some other perks over here. Sometimes they have free gym memberships. Sometimes they give you a Fitbit. Sometimes they give you a dental and vision. Just anytime that there's an extra perk, just read the fine print, because sometimes it's a limited perk, if you know what I mean. So you may have to go to a specific facility to get whatever that benefit is. Okay, so in review, you get to start Medicare on the first day of the month that you turn 65. Congratulations, you're doing amazing. You do have to make a decision. It is either or. You can either have original Medicare, Part A for hospital, B for doctors, date your drug plan, marry your supplement, or you can choose Medicare Advantage. Surrender your right to original Medicare to buy private health insurance contracted with the government, subsidized by you, to manage care instead of original Medicare. There are specific enrollment and disenrollment periods when someone can, after they've started coverage, come from one side to the other. However, your golden ticket may be expired. So you have one golden ticket. If you don't know which side of the page you want to be on yet, know this: you've got 3 months before your birthday, the month of, and up to 3 after, when you can pick anything on either side. If you know you want original Medicare, you can actually choose coverage 6 months before your birthday, okay, the month of or up to 5 after, without answering health questions. However, once you're outside those windows, even if you can change coverage, you may have to answer health questions or be subject to medical underwriting to get different coverage. All right, flip over your paper. It's time for a quiz.
We have one question.
Okay.
Why would anyone go with Medicare Advantage?
So it depends on their circumstance. So there's no one size fits all. Sometimes it's what makes the most sense in that circumstance. Sometimes it's a plan that's offered by a past employer. Sometimes it's just there's different reasons that people do it. And sometimes it's because their neighbor has it, or because it has a gym membership. Just don't get cancer. Yes.
Travel. If you're traveling, you both pay, say I go to California and I'm out there visiting for a month or whatever, friends or whatever. Do both of them pay?
So
Medicare?
if you have original Medicare, you have original Medicare everywhere in the continental United States. If you have a Medicare supplement that's not select, which means it's only sold in certain states, and that's just one type of supplement.
The heart.
But most of the hearts they go with you wherever you go. Okay, so you can get coverage that covers you wherever you go.
That's the same Medicare Advantage.
You can't have a supplement there. It's managed care, like in a network, so they'll combine your coverage in one HMO PPO. All right, you ready for your quiz? That was my last joke. It wasn't funny either. I had to tell you. Go ahead.
Okay, we have one more question. My spouse was disabled at 35 years and has received disability Medicare, and now is 65 and received a notice he is now on Medicare. Should we review his plans and update?
I think that anytime someone has guaranteed insurability, absolutely. I would, absolutely. Are you ready for the quiz? You got 2 questions, all right? One of them you have to answer here, and one of them you have to take home. Number 1, yeah, you get homework. You didn't know it was going to be that razzle dazzle. Number 1, are you glad you came? I need to hear a yes or no. I'm just kidding. No pressure, no pressure. All right, number 2, and I mean it, I really want you to do this. You take it home, okay? What do you want to be when you grow up? All right, that's it. Class dismissed. If you have any other questions, you've got my cell phone number on the little handout that I gave you. You can call me, you can text me, or you can email me. If you would like an individual consultation, text me just as soon as possible. Let me know when your birthday is and round about where you live so we can get you on the calendar.
Can you write your contact information on the board?
I sure can. You mean erase all
For
this?
those of us who are here, if you would like me to email you that guide, if you put your email address on the piece of paper, I'll do it when I send it out to everybody on.